أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الرحمن علم القرآن खलक़ल इंसान अल्लमहुल बयान। हमेशा की तरह आज का टॉपिक शुरू करने से पहले एक अच्छी बात, रिमेंबर वन पॉजिटिव थॉट इन द मॉर्निंग कैन चेंज द होल डे, सो ट्राई टू वेक अप एंड गिव सम पॉजिटिव stimulus to yourself. Today our topic of discussion will be, the topic of lecture will be acrodermatitis enteropathica. So this is a clinical manifestation of zinc deficiency. It is inherited in an autosomal recessive way, and this is a disease that mimic acrodermatitis enteropathica, characterized by malnutrition, or called acrodermatitis dysmetabolica. Remember this, also due to zinc deficiency, but they are not the genetic diseases. Acrodermatitis enteropathica presents in infancy when the child is weaned from breast milk. There is a high phytate concentration in cereals and soy milk, which inhibit zinc absorption. Geophagia also decreases zinc absorption. Acquired acrodermatitis enteropathica is due to zinc malabsorption due to food allergy such as celiac disease. So you can see the geophagia, and the kids come across that their parents complain about geophagia, and they also have the hypodermatitis rash. So transient zinc deficiency in preterm low birth weight infants exclusively breastfed, illustrating the importance of zinc in rapidly growing preterm infants. So this can occur, so you must supplement them with the zinc. So symptoms, how it presents, it presents in the late infancy or childhood. I am talking about the congenital one. There's a rash of periorifacial. Orifacial means around the orifices. Acral dermatitis. This is sometimes confusing. This is not orofacial, it is orifacial, orifices. There's a diarrhea, there's a fever, there's alopecia. 1/3 of the cases present with a triad of periorifacial dermatitis, diarrhea, and alopecia. The child may be irritable, there will be failure to thrive, and the child will have irritable and inconsolable cry. So history, there will be family history of similar problems in other kids. Any change in the diet history, such as a fat diet, such as ketogenic diet. Medical history, there can be history of cirrhosis, diabetes mellitus, nephrotic syndrome, celiac disease, IBD, and cystic fibrosis, which can cause acquired acrodermatitis enteropathica. So in examination, the general look, the child will be miserably looking and will have a depressed attitude. This is the characteristic rash, picture copied. And the child will have paradoxical irritability. What is a paradoxical irritability? Normally, when someone tries to soothe the child, comfort the child, they get relaxed. But in this case, when you touch the child, hold the child, they get more irritable. So vitals depend upon the condition can be normal also. So the specific area of examination is the skin. The skin will be erythematous, there will be vesicobulous or pustular regions. That can be confused with bullous impetigo. And there will be dry scaly or eczymatoid lesions which are distributed around periorifacial and acral areas, which are the characteristics findings. There will be sharply demarcated borders, remember, sharply demarcated. There can be paronychia. There will be bullous lesions which can be confused with epidermolysis bullosa. This is a child, periorifacial lesions on the cheek around the mouth, acral lesions of the toe. There will be partial or total hair loss. Acquired acrodermatitis has mild presentation. So something about the differential diagnosis, it can be due to congenital like we discussed, and acquired zinc deficiency, which is secondary to malabsorption syndromes and fat diets or prematurity and malnutrition. Atypical epidermolysis bullosa can present like that, and generalized or localized candidiasis can present like that. So investigations. So diagnostic investigations, you just get the plasma zinc levels if available, and the some things about these plasma zinc levels. You should send the specimen in plastic syringes. Red cell hemolysis gives erroneous results, and zinc levels are less than 50 microgram per deciliter. Low levels of alkaline phosphatase supports the diagnosis. IgE level raised in acquired acrodermatitis and enteropathica, the differentiating points. Skin or mucosal biopsy rarely performed. So a scenario can come to you in which the scenario will be looking like acrodermatitis and enteropathica, but in the lab data they will give you raised IgE. So that will tell us the difference between congenital and acquired acrodermatitis and enteropathica. Treatment is specific treatment. You should give the child zinc gluconate or sulfate in a dose of 1 to 3 mg per kg per day orally and 300 to 1000 microgram per kg per day IV rapidly, which can reverse the symptoms. Clinical improvement was seen within 5 to 10 days. So you just advise the treatment for at least 5 to 10 days. The lifelong therapy in congenital causes, whereas therapy can be stopped in acquired zinc deficiency. Emollients such as petrolatum applied 3 times a day for weeping or crusted lesions that can be held to soothe the child. So the complications, the high zinc can cause stomach upset and it also affects the copper metabolism. So it is a multidisciplinary management plan which includes the pediatrician, dermatologist, gastroenterologist and dietitian. So diet, beef has 5.8 milligram of zinc per ounce, chicken has 2.4 milligram per ounce and milk has 1 milligram per 8 ounces. So prognosis, untreated cases die in first few years due to diarrhea, bacterial and fungal infections. 100% survival with zinc replacement. So as we see, we give zinc in a patient of diarrhea. Why? Because it causes acquired zinc deficiency. Follow-up, we need to do the monthly follow-up for growth and development initially. Then duration of follow-up can be increased. So this was about the topic. I need your suggestions. That I'm thinking that to make it more interactive learning lessons, we should do the online case presentation. Any one of you who has presented, who has prepared a case, they can record a case and send it to me and I will upload it. And anyone can ask the questions and I can ask the questions too. So in this way it will be important and you can just upload the case without showing your identity so that other persons should understand and learn from it. Thank you very much for your listening and I wish thank you very much for your listening and I pray that Allah be our protector, helper and guide. Remember, try to spend your life on 2 basic principles. Number 1, try to follow, try to perform your duties in whichever capacity you are. जिस भी लेवल पे हो उधर अपनी ड्यूटी करें and try to love the living things. चाहे इंसान हो, चाहे हैवान हो, चाहे परिंद हो, चरिंद हो, सब जानदार मखलूक़ात से मोहब्बत करें और उनको तकलीफ़ पहुँचाने या उनकी तकलीफ़ कम करने की तकलीफ़ पहुँचाने से गुरेज करें या उनकी तकलीफ़ कम करने की कोशिश करें. अल्लाह हाफ़िज़.